I'm a urologist, and surprisingly, I get asked about chastity cages online all the time. So today, we're going to talk about it. Chastity cages for men, belts for women, how to use them safely, the difference between a device designed for pleasure and one that can land you in the emergency room. I'm Dr. Rena Malik, urologist and pelvic surgeon, and welcome to my channel, where you're going to learn everything you need to know to have a better sex life, greater urologic health, and live a long, healthy life. Speaking of living a great life, let me tell you about my new book, The Hard Truth. It comes out November 3rd and covers everything men need to know for good health, great sex, and a long life. It's basically everything I've put on this channel combined into one book. It's the guide I wish men had when they were younger and the one my kids are going to read when they get a little bit older. You can check it out to learn more and get $600 worth of free pre-order bonuses just for getting the book at renamalikmd.com/hardtruth. Now back to chastity devices. What are they exactly? They're basically devices meant to prevent you from having access to the genitals. And in some cases, it can be a safe and fun part of playing with sex and power dynamics, which is very popular in BDSM practices, as long as it's done correctly and consensually. So let me break it down. Male chastity cages are essentially devices that enclose the penis in a cage-like shell secured by a ring, and that ring sits behind the scrotum at the base. Unlike a compression ring, which I've talked about on this channel before in my video on penile compression rings or cock rings, these are not meant to help you get an erection. In fact, it's quite the opposite. It's specifically designed to prevent erections and not allow for stimulation. Now, female chastity belts are basically a waistband that's connected to a rigid or semi-rigid shield that covers the vulva, the perineum, and sometimes the anus. And it's essentially designed to restrict access to the genitals. So let's talk about the risks for men first. For men, the cage itself usually isn't the problem. It's the ring at the base. Anything that goes around the penis has the potential to cut off blood flow. Think about when you have a ring on your finger. If your finger swells, the ring becomes much more difficult to take off. If that finger were to continue to swell, it becomes painful, and then it can actually limit blood flow from getting to the finger itself. And this exact same thing can happen with a chastity cage, particularly if you leave it on while you sleep. Men have anywhere from 3 to 5 nocturnal erections every single night. Whether you plan for it or not, it's going to happen. And when it does, the base ring can constrict the penis, leading to serious problems. Now, what happens if that penis gets stuck or strangulated by the ring? There's not a lot of data on specific literature related to chastity devices. However, people get things stuck on their penis all the time, unfortunately. So medical literature has documented penile strangulation dating back to 1755, which means people have been doing it forever. One study looked at U.S. emergency departments over a 20-year period, and they found an estimated 6,344 penile ring-related injuries. That is a lot of penises harmed by rings. Now, the most common issue is that the ring gets stuck on the penis or the scrotum. And this is usually very treatable, but you have to get to the ER immediately. Time is of the essence. When patients wait over 72 hours to seek help, likely because they're embarrassed, maybe they're hoping that it'll just slide off, or they're altered, they're significantly more likely to have a serious injury, which can range anywhere from just having swelling to actual tissue death. Now, because scientific data is really limited, I actually looked online at chastity communities that were publicly available to see what people are talking about. So guys typically report waking up with nocturnal erections pressing against the cage, which can lead to bruising or skin tearing. Others actually describe getting this device stuck because the locks jam, or they lost the keys, or they do develop unexpected swelling and require even bolt cutters to get it off. And even one report of epididymitis, which is an infection of the tube behind the testicles, and that can be very painful. Now, some people claim that using these devices might cause penile shrinkage or permanent ED. The answer is no, that's not going to happen, because as I mentioned before, if you're healthy, you're going to get nighttime erections and your penis is going to get good blood flow. However, you might have some temporary changes in sensitivity, and some people do report having difficulty getting an erection immediately after wearing the cage for a long period of time. But again, that's usually temporary. Now let's talk about women. So women have very different issues compared to men. The chastity belts themselves create an area of prolonged pressure, and they trap moisture, heat, and bacteria against the skin. And this is because the shield rests directly against the vulva, including the labia and the clitoral hood or the wings. And the skin there is much more thinner and more vulnerable to irritation than skin anywhere else on the body. So this can lead to things like contact dermatitis. So if you think about the vulva, it naturally produces lots of different fluids. There's discharge, there's sweat, and there's urine when you go to the bathroom. So when you have a device occluding this area, you're basically creating the perfect environment for moisture to build up, friction, and eventually dermatitis, or essentially inflammation causing itching and pain and discomfort in the vulvar area. It can also put you at risk for infections like yeast infections or bacterial vaginosis. This is because occlusion itself increases friction and changes the vaginal microbiome, leading to potentially alterations, putting you at higher risk for yeast infections or bacterial overgrowth. When you have sustained pressure on any area of your body, that actually deforms the tissue and slowly cuts off blood supply. That's why people who are in wheelchairs need to be moved periodically, or people who are on bed rest need to move. Otherwise, they will develop bed sores. Now, when you're wearing a chastity belt for a prolonged period of time without any break, this can lead to pressure ulcers where the belt touches the skin. Next, you can also have urinary issues, right? If you're trying to urinate through the device, it can make it difficult because obviously it'll be messy, it'll spray everywhere, but also you can have difficulty wiping properly. And when you have trapped urine, that increases the risk of irritation of the skin and potentially might increase the risk of urinary tract infections because you have this sort of old urine sitting around near the opening of the urethra. And lastly, you might be at risk for chafing or even allergies. So when you purchase some of the metal belts, especially the cheaper ones, they can be made with nickel or low-grade alloys. And these can cause allergic reactions, severe chafing, and even rust when you're exposed to bodily fluids, which again, as I mentioned, are happening whether you want them to or not because your body makes discharge and sweat. Also for women, the other important thing is that pelvic and vulvar anatomy vary dramatically. So if you're looking to use a belt as a chronic user or you want to use it for more than a few hours, you want to invest in a custom molded device rather than buying a generic one, so you avoid all those chafing and uncomfortable issues. With all these risks I've outlined, you might be wondering, why would anyone even want to use a chastity device? A large study out of Norway looked at 4,000 people and found that BDSM behaviors, which include wearing chastity devices, are positively associated with sexual satisfaction. And over 1 in 3 participants in that study were interested in BDSM or had already practiced it, meaning that a lot of people are into this. And in those people who actually practice BDSM, there was really no difference in their overall mental health or relationship satisfaction compared to people who didn't participate in BDSM. In fact, BDSM practitioners tend to be highly educated and really excellent communicators. Interestingly, another study looked at hormonal changes during consensual BDSM activity. And what they found was that when participants had a positive experience, their cortisol or their stress hormone actually dropped and relationship closeness went up. Bottom line is, when you have a consensual power exchange, when it's built on safety, communication, and trust, it can actually be very bonding for you and a partner. So if you're interested, how do you play safely? If you're going to use these devices, you have to manage the physical risks. And here's how you do that. You pick and use a chastity device that is the best option for you. Let's start off with safety tips for men specifically. The material that you use for your device matters. You ideally want to avoid metal devices that would require you to use heavy tools to cut it off in case of an emergency. You want to use ideally medical grade silicone or polymers. You also want to check the fit. When you put your chastity device on when you're flaccid, you should be able to slide a finger under the base ring so that there's space in case there is an erection. If it's tight when you're soft, it's going to be really dangerous when you get an erection. You also want to set time limits. You want to ideally use them for 30 minutes or less to protect your blood flow. Now, if it's loose, it's not a huge issue, but when it gets tight, this is where after 30 minutes, we really start getting worried. And if you use it for longer, you want to make sure you remove it periodically and check your skin. Obviously, keep it clean, wash your device and your skin thoroughly, and have an exit plan. If it's something with a key, keep a spare key somewhere in a safe place. And if you notice swelling or color changes, don't wait, take it off immediately. And if it's stuck, do not delay, get to the emergency room. Now, for women, safety tips are very similar. You want to choose body-safe materials like medical grade silicone or high-quality stainless steel. Make sure you avoid those cheap alloys and ensure there's no rough enough seams or rivets that will be touching the skin, because that's where you can develop those little pressure ulcers. You want to prioritize fit and airflow. We don't want a really moist, tight environment. So the shield shouldn't press tightly against the vulva. You want some space for air to flow. Ideally, get that custom molded design, because that's going to be your safest bet. Take frequent breaks, guys. Make sure you take off the device periodically so that you can clean, dry, and let your skin breathe, especially in that area. And practice strict hygiene with these. Make sure you wash your device with warm water and then dry the area completely before you put the belt back on. And for anyone, particularly those using chastity devices, you want to make sure you communicate and have consent. Always have a plan in advance. Make sure you have a safe word or signal that if things are going south, that you guys can communicate easily. So bottom line, if you enjoy chastity devices, use them, but safely. Be careful, thoughtful, and prepared. And as always, you're going to take care of yourself because you're worth it.